Good afternoon, everyone. Thank you for being here. My name is Regina Kméczik, and the title of my thesis is Understanding Extracellular Vesicle Functions in the Oral and Maxillofacial Field. I'm a first-year PhD student and a dentist at Semmelweis University. My supervisor is Gábor Varga, my SMS is Bianca Golzio, and my vision is to reach the best achievable prognosis of head and neck cancer. And in order to do that, I'd like to test exosomal biomarkers for prognostic potential. I have two ongoing projects currently. Both of them are systematic reviews and meta-analyses, and both of them started this autumn. The first one is titled Prognostic Value of Exosomal Biomarkers in Head and Neck Cancer. Head and neck cancer is the 7th most common cancer in the world, with 890,000 new cases each year and sadly 450,000 deaths annually. The treatment of head and neck cancer is based on the patient's overall health, the age, the tumor's site, and prognosis. As you may see it on this figure, stage 1 or 2 cancers require single treatment, so irradiation or surgery, whereas more advanced cancer requires a combination of treatments, multimodal treatments. Head and neck cancer therapy will have long-term toxicities. So when we administer therapies, we must think about the quality of life changes that patients will go through. For example, almost 72% of survivors receiving multimodal treatment will report swallowing dysfunction in the everyday life. It's due to pain or the lack of saliva, which causes them a disability daily. On the other hand, 40 to 50% of patients will experience recurrence, meaning that we might not have been aggressive enough when it came to the treatment. So how do we tell which patient is overtreated or undertreated? How do we de-escalate someone's treatment safely while we are still able to achieve tumor control? The answer could be extracellular vesicles. These are produced by almost all types of cells, including tumor cells, and they contain extracellular cargo. These cargoes could be act as biomarkers, and thus the extracellular vesicles have a function in cell-to-cell communication. And these vesicles could be sampled from the cancerous tissues themselves, or blood, or even saliva. Our aim is to investigate the prognostic value of these exosomal biomarkers. The clinical question is, are exosomal biomarkers risk factors for mortality in patients with head and neck cancer? We will compare high concentration of exosomal biomarkers with lower concentration of exosomal biomarkers, and our outcomes will be survival outcomes. The hypothesis is that head and neck cancer prognosis can be detected based on exosomal biomarker concentration. And if this is true, then we can prevent over and under treatment in patients. We have 3 domains in our final search key. The first one refers to exosomal biomarkers, the second one refers to head and neck cancer types, and the third domain is requiring the survival and the outcomes. After the duplicate removal, we are left with more than 8,400 records currently. I have brought 3 key articles here. All of them had oral squamous cell carcinoma patients, and in exposure they had different microRNAs investigated, and the outcomes were Kaplan-Meier curves and hazard ratios. Currently we are at the title and abstract selection phase. The second project is investigating the diagnostic accuracy of exosomal microRNAs for head and neck cancer detection. As you may remember, head and neck cancer has a very high mortality rate. And also, the current diagnostic gold standard is this tissue biopsy, which is invasive, it's hard to reproduce, and it's often delayed, and this delay can cause a higher time of risk of death. So, we would like to improve further the prognosis of these patients. How do we do that? We want to focus on earlier detection and in a reliable, reproducible, non-invasive diagnostic tool. So our second aim is to investigate the diagnostic accuracy of microRNAs from blood or saliva samples. The clinical question is, what is the diagnostic accuracy of exosomal microRNAs from blood or saliva in adults with head and neck cancer? We will have two blood-derived and salivary-derived exosomal microRNAs, and of course they are relative to the histopathological conformation of the cancer. So our hypothesis is that exosomal microRNAs in blood or saliva can actively and accurately detect head and neck cancer, and if this is true, then we are able to enable earlier non-invasive or minimally invasive diagnosis. This is our preliminary search key. And I've wrote 4 key articles for salivary-derived exosomal microRNAs and 3 for blood serum-derived microRNAs. The first one had oral squamous cell carcinoma patients, whereas this one has laryngeal squamous cell carcinoma patients as population. So as a summary, I have 2 ongoing projects. Both of them I plan to submit this oncoming year. And I would like to end with a quote that I try to live by: "Have a heart that never hardens, a temper that never tires, and a touch that never hurts," from Charles Dickens. Thank you.
Thank you, Regina. You did a really good job. And I have one question regarding your first project, because I noticed in your first project key articles table, and different articles measure different miRNAs. Could this pose a problem in your meta-analysis?
Indeed, most of the articles, thank you for the question, most articles will have different types of microRNAs investigated. When it comes to this process, first they have a pilot study in which they either have a tumor tissue-derived microRNA bundle, which then they qPCR, and then they assess the levels of different microRNAs, and then they choose the highest one usually. And because of that, because there are so many different studies, there is no one standardized microRNA that everybody would want to investigate. So because of that, there is a huge heterogeneity. However, we plan to subgroup based on either microRNA families, or if this cannot happen, then what we do is get a selected part for each and every microRNA in the meta-analysis, as previous meta-analyses that are very similar but not the same have done before.
Okay, thank you.
Thank you very much.
Thank you for the interesting presentation. Going off of the question, the way they detected the miRNA, was it just qPCR, or was there a GWAS study or other studies, or did they use other forms like ELISA to, well, not ELISA, but like other forms, or was it more or less homogeneous whenever detecting the miRNAs?
Yeah, more or less homogeneous. Most research groups use qPCR. Yeah.
Thank you very much.
Thank you.
My question would be, first, congratulations, beautiful presentation. And my question would be, are these microRNAs pinpoint what type of cancer am I looking for? So, for example, if I take a blood sample and qPCR it, will I know that it comes from a head and neck cancer, or will I have a hunch that, okay, somewhere in the body there's probably some form of tumor?
Very good question. Depends on the study. Some studies have shown that there are certain types of exosomes with certain types of biomarkers on the exosome that are derived from only head and neck cancer. But for instance, breast cancer, hepatocellular cancer, etc., can have different types of exosomes as well. So when it comes to inclusion criteria, we have to take a look and see what kind of exosomes they isolated, and from that we can pinpoint whether or not it was head and neck cancer.
Thank you. Brilliant answer.
Congratulations, Regina. Can you just tell us a bit of what you think will be the potential limitations of implementing this exosomal testing into clinical practice? What do you think would be the potential limitations we could have?
On one hand, it's pricier than just a histopathological confirmation of cancer. So that's for sure a limitation and a big one. And there are multiple reviews that are trying to somehow highlight the importance that this is much more, like exosomes are much more minimally invasive and faster. So that's why we should invest in exosomes instead of the current gold standard. However, it's mostly either sample sizing, and because of the salivary samples, they can be harder to store, or the price issues. Those two, I think those two are the biggest limitations for now.